Hi, Dr. Parcells. I'm a 40-year-old woman who has had 2 kids. My breasts are saggy and stretched from pregnancy. I do not want implants, but I like a lift. Is there a certain type of lift I need to ask my plastic surgeon about? I don't know if there were different lift types or a lift is just a lift. Thank you. Okay, so yeah, this is a great question. There are 3 different types of lifts. It's going to depend on your anatomy, the way your chest wall is built, as well as the quality of your breast and the position of your breast and your areolas. So the first and most simple type of lift is something called a peri-areolar lift. And basically, that just means that your breasts are in excellent position, your nipple's in great position. It's just a little down, and we just want to pull the nipple up a smidge. This is a skin-only incision. I do these in the office. They take about 10 minutes, and patients are actually really happy because it does help reposition the breast tissue slightly. But again, it's not for everybody. I'd say it's probably for about 5% of patients who want to just have a small little lift, but they like the size of their breasts and they like most of the positioning. There's something called a lollipop or a vertical lift. So that's just going to be a lift that's around the areola and down. There are lots of plastic surgeons that offer this. I don't particularly like this lift technique because I think of your breast as a sphere. And so if we're going to shape your breast and get your breast back up onto your chest wall, I have to tailor the breast both in this dimension, which is the vertical portion, as well as this dimension, which is underneath. And so for that reason, I prefer the anchor incision, which is what this is. But yes, you can have any one of these 3 techniques. I personally prefer the anchor. When you're going to consider a lift, the most important thing to understand is that shape is always going to win over scars. Scars take 2 full years to mature, and there's a lot that we do in our practice to optimize scar healing, including our scar kit and some other in-office techniques that we provide. So let me know if you have any questions about this.